Introduction. Welcome, medical students, to today's histology lecture on the nasal cavity and paranasal sinuses. In this comprehensive script, we will delve into the intricate details of the anatomy, histology, and function of these structures. We will explore everything from the nasal cartilages and bones to the immune system within the nasal cavity. By the end of this lecture, you will have a thorough understanding of the nasal cavity and paranasal sinuses and their clinical relevance. So, let's begin our journey into the fascinating world of histology. The nasal cavity and paranasal sinuses are important parts of the upper respiratory system. The nasal cavity is divided by the nasal septum and filters, warms, and humidifies air while housing olfactory receptors. The paranasal sinuses surround the nasal cavity, lighten the skull, and may contribute to voice resonance and brain protection. Now, let's examine their structures in more detail. In summary, the nasal cavity is supported by various cartilages and bones, such as the lateral nasal cartilages, septal cartilage, alar cartilages, and major alar cartilages. These structures provide shape, support, and structural integrity to the nasal cavity. The bones, including the nasal bones, frontal processes of the maxilla, perpendicular plate of the ethmoid bone, and vomer bone, further reinforce and support the nasal cavity. Understanding these structures is crucial for comprehending the overall structure and function of the nasal cavity. The nasal mucosa is a complex layer that lines the entire nasal cavity and helps filter, warm, and humidify air. It contains specialized cell types such as ciliated epithelial cells, goblet cells, basal cells, and brush cells. The olfactory epithelium, responsible for smell, is located in the superior part of the nasal cavity and contains olfactory receptor cells. Understanding these structures is important for understanding the sense of smell and the nasal cavity's delicate sensory structures. Let's now explore the nasal conchae and turbinates in more detail. The nasal conchae, or nasal turbinates, are bony structures in the nasal cavity that increase its surface area and promote efficient warming and humidification of inspired air. They also help filter airborne particles. In the next section, we will discuss the paranasal sinuses. The paranasal sinuses are air-filled spaces in the bones around the nose. They affect voice resonance, reduce skull weight, and protect the brain. They have both physiological and protective functions. Next, we will talk about how sinuses drain. The sinonasal drainage pathways are a network of interconnected channels that facilitate the removal of mucus from the nasal cavity and paranasal sinuses. Proper drainage is vital for maintaining a healthy nasal environment and preventing the accumulation of mucus, infectious agents, and debris. The primary drainage pathway for most of the sinuses is the osteometal complex. This complex includes the maxillary ostium, the frontal recess, the ethmoid infundibulum, and the middle meatus. Mucus produced by the sinuses flows through these channels and eventually drains into the nasal cavity. Maintaining the patency of the drainage pathways is essential to prevent the development of sinusitis, which we will discuss in detail in the next section. Paranasal sinusitis is inflammation of the sinuses caused by various factors. It leads to symptoms like facial pain, nasal congestion, and headache. Treatment options include antibiotics and nasal saline rinses. Understanding its pathogenesis and management is crucial for medical professionals. Now, let's discuss nasal polyps and tumors. Nasal polyps are non-cancerous growths that can block the nasal passages and cause symptoms like congestion and decreased sense of smell. They are often treated with medications or surgery. Nasal tumors, on the other hand, can be benign or cancerous and require accurate diagnosis and treatment planning. The nasal cavity and paranasal sinuses receive a rich blood supply from branches of the internal and external carotid arteries. Innervation of the nasal cavity is provided by the trigeminal nerve, with different divisions supplying different regions. This knowledge is essential for understanding nasal diseases and surgical procedures in this area. The immune system in the nasal cavity defends against microbes and foreign substances. Physical barriers like the mucosa and cilia prevent pathogen entry. Innate immune cells, including macrophages and neutrophils, detect and eliminate pathogens. Adaptive immune cells, like B lymphocytes and T lymphocytes, recognize specific antigens and mount immune responses. Understanding this system is crucial for understanding nasal infections and allergies. The nasal septum divides the nasal cavity into two sides, providing support. Deviations can occur due to congenital or acquired factors, resulting in nasal obstruction. Treatment options range from medications to surgery. Knowledge of nasal septum anatomy and deviations is essential for evaluating and managing nasal obstruction. Various surgical techniques are utilized to access and address pathologies within the nasal cavity and paranasal sinuses. These approaches aim to restore proper drainage, remove obstructions, and improve the overall function of the region. Surgeries performed in the nasal cavity and sinuses include endoscopic sinus surgery, functional endoscopic sinus surgery, FESS, septoplasty, rhinoplasty, and sinus balloon dilation, among others. The choice of surgical approach depends on the specific pathology, severity of symptoms, and patient characteristics. In recent years, minimally invasive techniques such as endoscopic procedures have gained popularity as they offer improved visualization, reduced morbidity, and faster recovery times compared to traditional open approaches. Understanding the various surgical approaches to the nasal cavity and sinuses is essential for healthcare professionals involved in the management of sinonasal disorders. In conclusion, the nasal cavity and paranasal sinuses are complex structures that are essential for respiration, smelling, and immune defense. Understanding their detailed anatomy and histology is crucial for diagnosing and treating various conditions. Thank you for watching, and I hope you found this video helpful for your medical training.